Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Ryan, tell me what's going on.
Hi, my name is Ron. Having this low back pain. It's been going on for about 3 weeks now. That's gotten worse just in the past 2 days. I've been getting a lot of pain usually when I run, and I do a lot of lifting. Cut down on lifting. Even if I cut down on my weight, it still causes pain at my back.
So how much pain from 0 to 10?
Worse, about a 7.
Do you experience constant pain with motion?
I do have constant pain, more sore, ache pain.
How much from, like, you feel it now?
Like 2 or 3.
Which motion aggravated and how much?
I get most pain when I extend my back. With
Side bending it?
you get more when I flex, where I feel like my whole low back and legs are pulling.
Okay, we're gonna do this motion, but before that, tell me what kind of treatment you had before.
Haven't had any treatment. I've been doing regular stretches.
Okay, what else?
Foam rolling.
Okay.
I've done self-massage about the roller.
Okay, stand up. I want you to do the motion that's aggravated. Face me. Mark on your legs how far you can go down without pain. By your knees, a little bit over your knees, half a quarter way, okay? How much pain with that?
6 right now.
6, back up. Any sharp pain going down to your legs? Pulling. Where is your pain? Lower back or glute area? Radiating down on the right side. Okay. What other motion aggravated? Bend the other way. Turn around and do the side bend again. How much from 0 to 10? So it's more with flexion and side bend. Lie on your side. So it's more on the right side.
When I flex, it's
Face the window, lying your head this way. Let's get a gown and a pillow. Everything we do should be pain-free. If you feel any pain, let us know, and we'll change the maneuvers. So this is an instruction video. We're going to show you how we use Aster tools. Currently, we have several patents on those tools. We're going to use it to release fascia restriction and scar tissue. You comfortable in that position?
I'm fine.
We'll do the assessment and the release. Lower back, complaining with that. You feel that? Yep. Tightness, fascia restriction. Linda's using A1 to release the fascia. You can see in the video, it takes a second to release it. Designed to help the practitioner save their hands from pain and also to do fast release. So tell us what you feel now with those instruments.
A lot of pulling.
Pulling, okay.
It's not painful, but I feel like my tissue on the inside pushing out.
Any pain with that?
It's up here right now.
So I will get to the mid-spine area. And he was complaining on the spine, the lumbar and thoracic, not thoracic much, lumbar, and closer to the sacrum. Radiating to the right, glute going down to your ischial tuberosity, or how far it goes down?
On my left, when I get the side bend, it goes from the glute halfway through my
Hamstrings, so we're gonna work on that. How does that feel? Light. Yeah, we can see it. You're not sweating here, not yet. After that, we're gonna reassess the tissue and range of motion to see if change happened, then move on with the treatment based on patient presentation. You can use your hand if you need to, if it's area. Okay, let's stand up and reassess with the range of motion and see if you feel any difference. Bend forward and see how far you can go down. Any difference? Beautiful. Go backward. Does that look further?
Yeah, my spine started cracking back in place.
Let's do the side bend because you were complaining the side bend was in a neutral position. You don't feel it? Beautiful. So no sharp pain going down.
There's barely, but it's down here now. I think on my low back.
And when you did the forward flexion, did you feel any pain?
I feel a lot of pulling.
But
Down here.
but beautiful. Have you ever been able to touch the floor?
Back in high school, that's
10 years ago. Do you want to do that today?
if I can.
Yeah, we'll try to get you there, okay? Let's lie on your side again, okay? We're going to cover him and Use an instrument called A3 and A4 to release fibrosis, scar tissue. Check the range of motion after. We put the gown on him too. I want you to cover him while working on the glute. Elia, you're gonna be covered and make sure it's pain-free. So cover him while you work and really get on the glute area. Are you comfortable that we work on the glute area a little bit?
That's fine.
So get the performance and glutes. Do you feel, what do you feel, Linda?
It's rough.
Okay.
It's scar tissue, but I can feel it.
So you feel a lot of scar tissue there. How do you feel with those maneuvers? How? Yep.
I feel a lot of pressure at the same time when the tool is running over my skin. Like little balls. I feel like the tool is just jumping over.
Correct. Those balls are actually the scar tissue, the fibrosis. So because you have fibrosis there, the instrument kind of jump. It's not like going smooth. Yeah. Would you show him like an area that he does not have a scar tissue so he can feel the difference? Hopefully he has a good area.
See how those bumps are popping up?
Yeah.
So it's just so tight. There's like scarring there.
So yeah, when there is no scar tissue, the tool should go very smoothly. But when you have a lot of scar tissue, it's just those feel like rocking away.
Sure.
Yeah. But make sure it's pain-free. Linda, tell us how easy to use or how difficult to use the Aster instrument.
Not difficult at all.
Okay.
It's super easy. I don't feel sore. I don't anything at the end of the day. My hands don't hurt. Do soft tissue.
Before you used to use what?
Hands loosely and some grasping tool and thugs. At the end of the day, my hands were sore, dry and crackly. It was terrible.
But with the instrument, you don't feel that? Yeah. And how long it took you to really be comfortable to use the instrument after taking the class?
Oh, after the class, I felt much better. Tried a couple more people since and getting a better feel. I'm good.
So, like, it took a couple of days, a week, or
I'd say if I were to work on a patient every day, it would just probably like 2 days. Really.
2 days to really be comfortable to use the instrument? Do you feel the class was enough practice to get the feel of it?
Yeah. So she does a lot of one-on-one time, which is great. Our class were nice and small and intimate, so there was a lot of opportunities for questions and answers. It was really nice. I recommend it.
Awesome, thank you. All right, after a break, we're gonna clean up and then check your range of motion. We'll leave the gown intact. We're gonna do the same range of motion we did before to see how you're doing. How's that?
Lower.
Before you were touching the...
Like halfway through my socket.
Okay, let's go backwards. Any pain, discomfort? Side bend? You have more flexibility.
Yeah.
Okay, let's do the side bend. Nice, look at that. You beautiful. Do the other side. No sharp pain going down. You still have some restrictions here. Okay, lie on your side again. The same instruments. The big one. Yep. At the same position, we'll get his hamstring. Yep, and IT band. So with Aster, we actually do a lot of assessment to see how patients respond to the treatment. And protocols provided in the class with the instrument. How does feel on your IT band?
I can feel like the scar tissue itself.
It's bumpy.
The ones I have here, they're a lot bigger.
And you said you've been doing the stretches, you've been doing foam roller, but you still have the issue. Yep. So with Aster, we try to look at, based on patient presentation, to ask the question, why there is a symptoms, why patient experience that pain. And instead of doing stuff to address the symptoms, we try to get to the root of the problem. We barely do stretches here, or we try to figure out scar tissue, fibrosis, fascia restrictions, muscle spasm, trigger point, alignment issues. That's part of the holistic approach of Aster to figure out where is the problem coming from, and based on that, we customize the treatment. Our goal is to get the pain under control as fast as possible and transition patient to neuromuscular re-education. And I don't do the neuromuscular education in the video, but that's what we do after that treatment. Usually the expectation is patients gain range of motion, decrease pain, the Aster instrument, and then we utilize neuromuscular education exercises. After that, we'll check the range of motion. I can hear that if you want. So we can see that it's very gentle. We don't cause bruises or pain. We disagree with this philosophy because that actually will cause more fibrosis. Let's clean that, and we're gonna reassess the range of motion again and see how you're doing. Okay, so let's do the bending again and see how is that. How is that?
I can touch my ankles.
You can touch your ankles. Okay. How'd that feel?
Feels good.
Can you tell me your experience with Aster?
So far, it's been really good.
Can you tell us your background in medical field?
I'm a nurse, practicing nurse. I finished physical therapy assistant school. My work background is a lot of standing, walking, a lot of push and pull too.
How does that feel?
Feel loose.
Feel loose. How long it takes to loosen up?
I haven't felt this loose in a while, actually.
Distance release.
Yeah.
That's our goal. That's actually one of the core value of Aster is fast result. If the treatment is not fast, that's something we have to see why there is no fast result, because that's one of our core value. Core value is to have an instrument or maneuver that save time for the therapist and the patient. Stand up. Let's bend forward and see how far you can go. How's that? You're almost there. Where do you feel the tightness? Okay. When you come back, come all the way like this. So let me work with you again. Our goal is actually to help therapists to have an instrument and tools to get fast results with their patient instead of using stretching and stuff that's really, basically studies show it's not really very long-term effective, like to relieve pain or, so our goal is to provide fast long-term pain relief. You feel that?
It's like
You feel the tightness?
Yeah.
You feel the tightness? Okay. Gonna use other instrument. Yeah. I'm using A1 to use restrictions. In the class, you will learn how to use it with the prequels. Everything is written down. There will be time to practice enough to make the therapist comfortable to start working with it. Stay on patient. Okay. Stand up. You get the full body. How's that?
touch the floor.
So when the last time did you do that?
10 years ago.
2 years ago. Yeah.
Yeah.
Now let's do it 10 times. Any pain?
Now it's feeling pull, but stretching pull.
I think that's a, yeah, keep going. So this is not a placebo effect. I've been doing it 10 times now without the sharp pain. How's that feel? Let's do the side bend.
Just feel the stretch.
Yeah, because you're,
Nothing on the side.
that's look like normal. Right. The other side.
I shouldn't just slide, right?
Still feel some more restriction there, but there's no pain.
No pain. All right, extension.
That's the chill on here because it's so little. I'm turning.
I'm feeling crunch. I can still feel my spine just moving into place though.
Okay, so that's good. Let's have a seat and tell me, what do you think about Aster?
That's amazing. Honestly, when I heard about it, I was skeptical about how we were saying how fast it is, but I didn't believe it does help. It's instant relief.
Oh, yeah, thank you so much. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.